Good evening, folks. Today I want to talk about the treatment options available for baldness. There is not much evidence, the evidence is limited, but the efficacy of intralesional or topical corticosteroids as the initial treatment for alopecia is well established. Now, let me talk about the intralesional corticosteroids. Now there are other treatments like immunotherapy and all that, but intralesional corticosteroids is something we can do in our offices. We suggest intralesional corticosteroids as the preferred therapy for adults with isolated patches of hair loss. Now, what about the efficacy? Now, there are no randomized trials for intralesional corticosteroids. One study reported regrowth of tufts of hair at 33 of 34 sites injected with triamcinolone hexastenide in 11 patients, and at 16 of 25 sites injected with triamcinolone acetonide in 17 patients. So you see, it's a good treatment. In most cases, it is working. And another study showed regrowth of hair after 4 months in 40 of 62 patients. So that's like 63% success. So you give monthly injections of triamcinolone acetonide. That's a steroid. So you're giving steroid right into their head or into their face like that. Now, how do you administer this? First of all, anesthesia. How do you give anesthesia? There is lidocaine cream or prilocaine cream. So this is lidocaine like 2.5% or prilocaine cream like amla cream like 2.5%. Take this cream, apply all over the head, and leave it like that. Don't just go immediately after that. Put that, tell the patient, go and wait for a couple of hours in my office. Put like a nice shower cap on the head. So when the patient is ready, remove that shower cap and take triamcinolone like 2.5 to 5 milligrams per ml and inject it into the upper subcutaneous on the face. So for the face, like for example, if the patient has eyebrow problem or beard involvement, then give that. Then concentrations like 5 to 10 mg per ml are injected into the upper subcutaneous of the scalp. So for the scalp, you can go at a higher dose. So small volumes like 0.1 ml are injected into multiple sites, like 0.1 ml into like a site, separate the sites like 1 centimeter each, and the maximum dose I suggest is like 40 milligrams. That's the maximum dose for each session. Some patients say, oh, give me, I don't care. Give me how much you want. It doesn't work like that. Don't exceed more than 40 milligrams per treatment. If the patient says, I need more, tell them, please come back. We can do this like 6 to 8 weeks. Every 6 to 8 weeks, you can repeat these treatments. So repeat them as long as I would say 6 months. You can go like every month for 6 months. And in many times, as I have shown you, these intralesional corticosteroids, they help. Even after 6 months, it's still not helping, then stop there and send them for immunotherapy. Now, what about the adverse effects? Adverse effects with like all steroids, there is a skin atrophy at the site of the injection. And there are other cutaneous side effects like hypopigmentation and telangiectasia. Sometimes when you give these facial injections, you need to be careful. Sometimes if you are not hygienic and if this is not sterile, you can give them like cellulitis and infections. So these things need to be done in a good sterile atmosphere. And if you are a non-dermatologist, and the patient wants something on the face, it's better to send them to the dermatologist. And there is also the risk of adrenal suppression, but that's very, very rare. I mean, there is no literature on this. If you use intralesional corticosteroids, what is the chance for the patient to get adrenal suppression? Unfortunately, that's a possibility, but it's a very, very rare, and actually there are no studies that showed this problem happened in any of these patients. So give anesthesia. A good anesthesia is very important. And after giving this anesthesia, wait. That's very important. Some patients are taken immediately and they will cry with pain because the anesthesia did not sink into their skin. So it's very important that you wait like an hour at least before you start. So unfortunately, many people are suffering with baldness, and it has so much side effects. So many people worry a lot. They are so anxious about their hair, especially like teenage years when they are losing these hairs, even due to hormonal problems and imbalances. They worry a lot, and their anxiety spikes up. So you need to reassure them and offer these treatments. Especially something we could do is intralesional corticosteroids. So use intralesional corticosteroids in that way at the doses I have shown, and especially the triamcinolone acetonide. Use that. It is also affordable compared to other steroids. I hope these things helped you. Please leave your comments. Thank you very much. Have a good evening.